Hi, I'm Dr. Lili, and this is my pocket pediatrician. Drowning is terrifying. My kids are 1, 2, 4, and 6. That means that 3 of my 4 kids are at very high risk for drowning, just because of their age alone. Going to the pool or the beach no longer means flip-flops, sunscreen, a towel, and a good book. In addition to all the goggles, sunscreen, flotation devices, snacks, swim diapers, and everything else I have to drag to the pool. After we spend 45 minutes getting everything we need and getting to the pool, I'm not going to be sitting there having a good time. I'm going to be doing constant head counts, trying to make sure I keep my little ones all within touch supervision and have constant eyes on my bigger child. And by the time we're done swimming, I'm absolutely exhausted and worn out, have to drag all that stuff back home and put on a happy face and pretend like I had a good time, because my kids absolutely love it and they want to do it pretty much every single day in the summer. Drowning is absolutely something I take completely seriously. I've seen too many cases of fatal and non-fatal drownings in my time working in the pediatric emergency departments, and drowning is nothing to take lightly. However, in the last couple of years, I've had countless visits from parents with generally well-appearing children who are there in the middle of the night in the emergency department concerned that their child may have dry drowned. These children are often sitting there eating chips, playing on their parents' phones, doing homework, and their poor, stressed-out parents are anxiously awaiting my exam, convinced that their child might die at any minute. Today, we're going to clear up some of the misconceptions about dry drowning, and I'm going to give you the tools so that you know when you need to worry and when you can determine that your child is okay.
When the doctor says my child has a condition, I'll learn more at my pocket pediatrician.
I decided to do this topic this week because it was requested by Marlene. So Marlene, I hope this is helpful, but I'm also starting to see a lot of concerned parents with their generally well-appearing children who may have swallowed a bit of water in the pool coming to the emergency department at all hours of the night just to get checked out. So let's just start with the basics. What is drowning? The medical definition of drowning is respiratory impairment from submersion or immersion in liquid leading to hypoxia, which means reduced oxygen levels. The word drowning actually means that death has occurred from water in the lungs, causing decreased oxygenation and irreversible injury. If the child is rescued before death, the episode is called a non-fatal drowning. Children who survive a non-fatal drowning can range from having no symptoms at all to having permanent brain injuries and disabilities. If you suspect that a child is drowning, you should remove the child from the water immediately. If the child isn't breathing, start CPR immediately. If there's somebody available, send them to call for help or to call 911. If no one else is available, just go ahead and give 2 rescue breaths and start CPR right away. Continue CPR until the child starts breathing on their own, and then you can call 911. If your child has come close to drowning, they should have an immediate medical examination. Any symptoms beyond what you would expect if your child were to take a drink of water and it went down the wrong pipe and they just cough for a second or two, that would be okay. But if anything beyond that, you want to go ahead and take them to get a medical exam right away. Particularly if your child is having difficulty breathing, a fast heartbeat, confusion or altered mental status, any changes in body temperature, whether that means they're having fever or they're actually hypothermic when their temperature gets low. If at any point your child stopped breathing, inhaled water, or lost consciousness, even if they seem fine now, they should get an immediate medical exam. Most likely in those cases, the child's going to be admitted to the hospital and observed for at least 24 hours to ensure that they don't develop any respiratory distress or later symptoms. Also, I need you to remember that drowning doesn't look like drowning does in the movies. You don't see people splashing around and screaming for help. Most often, drowning is actually silent. People who are drowning often just have their head low in the water. Sometimes it's tilted back with an open mouth. Sometimes you see their hair kind of fall across their forehead or their eyes. Their eyes might look empty or glassy, or sometimes even closed. Sometimes they're not using their legs. Sometimes it looks like they might be kind of climbing an invisible ladder. It might roll onto their back. And sometimes they look like they're trying to swim, but they're not getting anywhere. If you come across someone with these signs, chances are that they need help or an immediate rescue. Some children, even strong swimmers, can just slowly sink to the bottom of the pool without anyone noticing, and they're later found at the bottom having drowned. So that's drowning. Fatal and non-fatal drownings are terrifying. So imagine the fear that parents have been experiencing in the last few years after stories started circulating about children who seemed completely fine at the time and then hours or days after a small water exposure suddenly died. This seems like every parent's worst nightmare. Your beautiful child could seem completely fine and suddenly drop dead. No wonder these moms are dragging their children to the emergency department at all hours of the night to see if they might be about to suddenly drop dead. I don't blame these mothers. I've read the articles too. They're so scary. The premise behind them usually is that a small child got splashed with water or a wave crashed over the child, and hours to days later, they developed acute respiratory distress and suddenly died. The media reported several such stories with some pretty confusing terms, and now parents are petrified, dragging their perfectly fine chip-eating kids straight to the ER to see if they have dry drowning or secondary drowning or a near drowning. Some of these media stories were reported before a cause of death was actually determined. For example, one boy who was reported to have dry drowned actually had myocarditis, an infection of the membranes around the heart. So that was the actual cause of his death, and it was unrelated to his water exposure. Experts disagree on whether or not dry drowning or secondary drowning is even a real term. There are two terms that confuse people. The first is dry drowning, which means a small amount of water is inhaled. This causes the vocal cords to spasm and cuts off the oxygen supply. This is immediate, and the child would need immediate medical attention. The other term is called secondary drowning, which generally means that a child aspirates a small amount of water into the lungs, which then causes a lot of inflammation within the lungs. That chemical irritation from the aspiration causes fluid overload, where inflammation in fluid causes a condition called pulmonary edema, and that can lead to acute respiratory distress, which can cause respiratory failure when you're unable to breathe anymore. This is a real phenomenon that can actually happen, but it is incredibly rare. And children generally don't go from very well appearing to suddenly dying. It's usually a progression of symptoms with progressive signs of respiratory distress as the child's condition deteriorates. However, both of these conditions are exceedingly rare. Many parents have confused aspiration, which means that you have inhaled fluid down into your lungs, with swallowing water, which just means that you actually swallowed some water down into your digestive tract, where it would have entered the stomach. I don't know about you, but my kids have probably never left the pool without having swallowed a very generous amount of pool water. My 1-year-old actually just walks up to the little fountains that are in the shallow end, bends over and takes a drink as if he's just at a regular water fountain. My bigger kids are a little more subtle, but I'm constantly telling all of them to stop drinking the pool. Obviously, with all of the chemicals, the pee, the occasional frog we find, and I don't even want to think about the rest of what's in there, most kids who swallow pool water will eventually vomit or get a little stomach upset. When your child vomits a few hours after being in the pool, it's really easy to suddenly think, oh no, is she dry drowning? The articles and the confusion abound on social media. The great influx of people to emergency departments led several doctors to start trying to educate the public about what these terms actually mean. Neither dry drowning nor secondary drowning are actually accepted medical terms. Everything still falls into the category of either drowning or a non-fatal drowning. If your child was found unconscious or not breathing, obviously they need immediate medical attention. If they had a small event, but they're showing signs of respiratory distress, they should also get an immediate medical exam. Signs of respiratory distress might include you seeing their nose or their nostrils kind of flare out like a bowl with every time that they're breathing. They might be using extra muscles to help them breathe, so you might actually start to see a gap above the collarbones or in between their ribs when they're taking a deep breath. Or you might notice fast breathing, a frequent cough, chest pain, drooling, foaming at the mouth, lethargy, or any other concern like that. If you're seeing any of those signs, your child should get an immediate medical exam. I remember when our oldest was 1 and he was walking around the kiddie pool in our neighborhood and I was holding our new baby in my arms. He tripped and fell face down in the water. I was practicing touch supervision, so I was able to grab him immediately, and he only had his face in the water for a couple of seconds. He coughed for a minute and he cried, and then he went right back to playing and seemed completely fine. Even though he showed no other symptoms at all, there I was, a mom with all of a year and a half of experience. So that night I snuck into his room about 4 or 5 times with my stethoscope and listened to his back while he was sleeping to make sure that his lungs sounded clear. He was completely and totally fine, and I didn't need to do that, and we both would have probably been much better off had I just gone to sleep that night, since he had no symptoms whatsoever. I'm just telling you this so that you know I am a mom. I love my kids. I can find all kinds of things to worry about with them. And I totally understand that terror that something terrible could happen to my sweet little baby. I totally get you mothers who are dragging your Dorito-eating children to the ER in the middle of the night, who never even had a drop of water in their lungs. I really do. I'm not making fun of you. I just want you to know that if your child had an episode concerning for drowning, he or she should be checked immediately. If your child is having respiratory symptoms like the ones that I described, then without a doubt, bring them in. But if your child may or may not have swallowed a little bit of water in the pool, or maybe vomited a few hours later, but is having absolutely no respiratory symptoms at all, that's not drowning. It's not a non-fatal drowning. It's not a near drowning. It's not a dry drowning or a secondary drowning. It's not drowning with delayed mortality. And it's not whatever term that's going to get made up in the next few weeks as people are trying to get more stories out there. That just means your child drank some nasty pool water, and hopefully they're not going to wind up with diarrhea or whatever other illness is getting passed around this summer. I hope this information can give you a little peace of mind. At the end of the day, whatever you want to call it is not what's important. What is important is preventing drowning in the first place. Young children should be within arm's reach within any body of water. Close parental supervision that is distraction-free is the most important factor in keeping your kids safe. Preventing access to large bodies of water such as a pool without close parental supervision, such as having a four-sided fence around your pool, is the second most important factor. Swimming lessons are also vital when they're age appropriate. Just remember that nothing is going to replace close parental supervision. Nothing can drown-proof your child. And having close parental supervision in the pool will hopefully prevent you from having to spend all night wondering if something might have happened in the pool that could have harmed your child. If you're worried that something isn't right with your child, seek medical attention immediately. Even if you bring your chip-eating children playing video games to me, I promise I'm going to do a good exam and let you know if there's anything you need to worry about. This is Dr. Lili with my Pocket Pediatrician. Please comment below. Let me know what you think. I'd really love to hear from you. Also, make sure you hit that little red subscribe button down there in the corner so you don't miss out on any new content. I hope this segment on dry drowning was helpful. Thanks for stopping by.
When the doctor says my child has a condition, I'll learn more at my Pocket Pediatrician.